Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what prenatal care is, pre-pregnancy care and epilepsy, the importance of planning for pregnancy, doctor-patient communication, the 3 trimesters, and resources available. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Prenatal care is the care that a woman receives when she is expecting. Care can be given by an OB-GYN or a midwife. Prenatal care is important to make sure the fetus is developing properly and that the mother is receiving the care she needs. Prenatal care is important for any mother who is expecting, but it is especially important for mothers who are battling chronic illnesses such as epilepsy. It is best to plan any pregnancy, even if you are healthy. If a woman is chronically ill and an unplanned pregnancy occurs, it can put both her life and the fetus's life at risk. It is essential to take proper precautions to prevent unplanned pregnancy. For women who have epilepsy who want to become pregnant, talk to your OB-GYN and neurologist before trying to conceive. Your medication may need to be adjusted or changed by your neurologist. Your OB-GYN will start you on folic acid and a prenatal vitamin to get your body ready for when you can start trying to conceive. Communication is essential in not just planning to become pregnant, but also why you are going through pregnancy. You want doctors who are going to communicate and make sure everyone is on the same page when it comes to your care and goals. It is important to plan your pregnancy to prevent any birth defects from medication. According to Mayo Clinic, common birth defects are cleft palate, neural tube defects, skeletal abnormalities, and congenital heart and urinary tract defects. In the article, The Management of Epilepsy in Pregnancy, the authors stress the importance of screening for possible birth defects, which should occur between 11 to 13 weeks into the pregnancy. Along with physical defects, anticonvulsant medication can also have an effect on cognitive development. Learning disabilities, a decrease in neuropsychological performance, and a reduced verbal IQ are at risk, especially children who were exposed to valproic acid while in utero. It is important to have a team of doctors who are ready to listen, answer questions, and help you as you go through your pregnancy. Do your research in finding the right doctors to help you reach your goals. Reach out to your insurance company and look for reviews when it comes to any of the doctors you are considering seeing. Any doctor who has a history of negative reviews, several, not just a couple, is best to avoid. If you see a doctor and they reply, quote, "I don't have time to answer questions," end quote, this is not the doctor you want to be part of your pregnancy journey. During the first trimester, many changes start to take place as the embryo develops inside the uterus. According to Johns Hopkins, from weeks 0 to 8, the fetus is called an embryo. By the end of the first trimester, the fetus is averaging 0.5 to 1 ounces in weight and averages 3 to 4 inches in length. This is the time that complications can arise. That is why it is important to talk to your doctors about medication options before conceiving. According to Mayo Clinic, common symptoms of pregnancy are tender, swollen breasts, nausea with or without vomiting, increased urination, fatigue, food cravings and aversions, heartburn, and constipation. According to Johns Hopkins, the chart below explains the normal benchmarks for the average fetal development. By the end of 4 weeks, all major symptoms and organs begin to form. The embryo looks like a tadpole. The neural tube, which becomes the brain and spinal cord, the digestive system, and the heart and circulatory system begin to form. The beginnings of the eyes and ears are developing. Tiny limb buds appear, which will develop into arms and legs, and the heart is beating. By the end of 8 weeks, all major body systems continue to develop and function, including the circulatory, nervous, digestive, and urinary systems. The embryo is taking on a human shape, although the head is larger in proportion to the rest of the body. The mouth is developing tooth buds, which will become baby teeth. The eyes, nose, mouth, and ears are becoming more distinct. The arms and legs can be easily seen. The fingers and toes are still webbed, but can be clearly distinguished. The main organs continue to develop, and you can hear the baby's heartbeat using an instrument called a Doppler. The bones begin to develop, and the nose and jaws are rapidly developing. The embryo is in constant motion but cannot be felt by the mother. From embryo to fetus. After 8 weeks, the embryo is now referred to as a fetus, which means offspring. Although the fetus is only 1 to 1.5 inches long at this point, all major organs and systems have been formed. During weeks 9 to 12, the external genital organs are developed, fingernails and toenails appear, eyelids are formed, fetal movement increases, the arms and legs are fully formed, and the voice box or larynx begins to form in the trachea. According to Johns Hopkins, by the end of the 2nd trimester, the fetus is anywhere from 13 to 16 inches long and weighs around 2 to 3 pounds. Changes during the 2nd trimester are: the fetus kicks, moves, and can turn from side to side. The eyes have been gradually moving to the front of the face, and the ears have moved from the neck to the sides of the head. The fetus can hear your voice. A creamy white substance, known as vernix, begins to appear on the fetus and helps to protect the thin fetal skin. Vernix is gradually absorbed by the skin, but some may be seen on babies even after birth. The fetus is developing reflexes like swallowing or sucking. The fetus can respond to certain stimuli. The placenta is fully developed. The brain will undergo its most important period of growth from the 5th month on. Fingernails have grown on the tips of the fingers and toes, and the fingers and toes are fully separated. The fetus goes through cycles of sleep and wakefulness. Skin is wrinkly and red, covered with soft, downy hair. Hair is growing on the head of the fetus. Fat begins to accumulate in the fetus. Eyelids are beginning to open, and the eyebrows and eyelashes are visible. Fingerprints and toe prints have formed. Rapid growth is continuing in fetal size and weight. The 20th week marks the halfway point of the pregnancy. A fetus born at the end of 24 weeks may survive in a neonatal intensive care unit. The 3rd trimester can be challenging for expecting mothers. As your due date gets closer, many mothers feel uncomfortable and are looking forward to delivering. Many mothers are also anxious to deliver, especially first-time mothers. Do what you can to relax and prepare yourself. Taking a bath, doing yoga, and meditating are just a few examples of what you can do to help your body as you progress through the 3rd trimester. According to Mayo Clinic, common symptoms of the 3rd trimester are Braxton Hicks contractions, backaches, shortness of breath, heartburn, spider veins, varicose veins, and hemorrhoids, and frequent urination. According to Johns Hopkins, during the third trimester, the fetus is beginning to position itself head down to prepare for vaginal birth. Not all fetuses do so. If a baby is breached, many doctors will opt to perform a C-section if the baby is not in the proper position. By the end of the third trimester, the average fetus is 19 to 21 inches in length and can weigh 6 to 9 pounds. Changes during the third trimester are: the fetus can see and hear, the brain continues to develop, the kidneys and lungs continue to mature. By the 36th week, the head may engage or drop into the pelvic area, a process called lightening. The bones of the skull remain soft to make it easier to pass through the birth canal. For many babies, the irises of the eyes are slate blue. The permanent eye color will not appear until several days or weeks after birth. The fetus can suck its thumb and has the ability to cry. By 38 to 40 weeks, the fetus's lanugo, or fine soft hair on the body and limbs, has disappeared almost completely. By 38 to 40 weeks, the lungs have matured completely. The baby is covered in vernix, a creamy protective coating on the skin. The head will usually turn downward during the last couple of weeks of pregnancy. There are many resources available during pregnancy. Myself, having a high-risk pregnancy, having 2 boys, I can't recommend enough of using a doula or someone who is trained to provide guidance and support to a pregnant woman during labor. Doulas are very important because they help you in going through childbirth class, preparing your birth plan, and guiding you and your partner as you are getting ready to bring your child into the world. There are many different websites where you can find a doula. The one that I've provided, doulamatch.net, can help you find a doula in your area. Also talk to your OB-GYN because many will work with doulas in the area, and any that they've worked with that they've had a positive experience with, they can recommend to you. Another very important thing is a birth plan. The information I provided here from AmericanPregnancy.org will help you in putting your birth plan together and making sure you are listing your goals properly. So pretty much what the birth plan is you are making a plan of what you want while in labor. But you also need to realize that changes can happen while you're in labor. What you want to happen and what may happen can be 2 very different things. And it is essential for you and your doctor to come to an agreement so that when you do go into labor, everyone is on the same page. Another thing that is very important is the terminology that you use for your birth plan. For example, I did not want to have an epidural because I had a real bad experience as a child. I went into status, they couldn't figure out why, and they decided to do a spinal tap while I was having a convulsion. The spinal tap brought me out of the seizure, and it was an extremely traumatic experience to be pinned to the table with a needle in my spine. And I still remember to this day. So when I decided to have my son, just the thought of the epidural brought back that memory, and I made up my mind I wanted to avoid one at all costs. So when writing my birth plan, I did not write, I will not have an epidural, because something may have happened that would cause one to be necessary. And if you put, I will not, your doctor is not going to accept any birth plan where you're giving demands or making it look like you will refuse to comply with treatment. So when I wrote my birth plan, I instead put, I would prefer not to have an epidural. However, if a situation arises where one is necessary, then I will consent to having one. You have to meet your doctor halfway because this is a team effort. And if you're willing to do that, it will greatly increase the chance of your doctor supporting your birth plan and helping you to reach your goals. Now, I can say when I had my first son, and I did not want to have that epidural. I actually ended up having to have one in my first birth because when I went into transition, I began to have the urge to push, but my son was not ready to descend. And so it put not just myself in distress, but it started to put my son in distress. So they gave me an epidural so I could rest. And then once I woke up, I was fully dilated. And a little more than 30 minutes later, my son was born. So it's a perfect example of we know what we want as expecting mothers, but it doesn't mean that's truly going to be what happens in the situation. So realize that what you want and what can happen can be two different things, and you want to have a doctor who you're going to meet halfway and they're willing to help you, but also expect you to trust them in making any type of suggestions when it comes closer to your delivery. Now, the American Pregnancy Association offers a lot of great resources for pregnancy planning, childbirth classes, going through your pregnancy, labor and delivery, and postpartum care. So please visit their website at www.americanpregnancy.org for more information. Prenatal care is the care that a woman receives when she is expecting. It is important to work with your OB-GYN and neurologist even before becoming pregnant. As you progress through your pregnancy, communication is essential for both the fetus and mother. There are many resources available to help expecting mothers as they go through their pregnancy and prepare for childbirth. To learn more about prenatal care and epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.